Hickman's catheter flushing and exit site dressing. Prepare all necessary requisites. Refer to the relevant standard operating procedure protocol for this. Note that the requisites listed here are for a 2-lumen Hickman's catheter. Place all relevant items on a thermoplastic tray. Place it below on a disinfected trolley. Put on a gown and mask and perform a surgical hand wash. Remember to ensure patient's privacy. Put on a pair of non-sterile gloves after hand hygiene for universal precautions prior to removal of the existing dressing. Release all anchoring tapes and wraps. Avoid tugging onto the Hickman's catheter. Place a clean sheet below to create a clean emplacement for the catheter tips. Remove any existing tapes and gauze around the catheter. For this patient, there are 2 lumens, and so we will require 4 syringes and 2 needleless connectors. Each lumen would require 1 syringe for a normal saline flush and another for the heparin lock. Using a non-touch technique, prepare to withdraw the necessary flushing and locking solutions. Begin with a normal saline up to 8 ml per syringe. To avoid confusion during administration, please take note of the placement of the 2 different filled syringes. Proceed to draw the heparin saline. Each heparin syringe should be filled up to 5 ml. Using a non-touch technique, connect the needleless connector to the normal saline syringe and prime. Prepare 5 alcohol swabs per lumen. Pre-tear them and place it in an upright position on the tray. Swab at the connection point. Swab vigorously to create friction. Use all 5 swabs. Ensure the connection point is dry before disconnecting the existing needleless connector from the hub of the Hickman's catheter. Using a non-touch technique, connect the new needleless connector. Release the clamp of the catheter and tilt upwards when withdrawing. Once the backflash of blood is seen, flush in a pulsating motion using a push-pause method. Clamp the catheter while pushing in, leaving about 1 to 2 ml of fluid in the syringe. This will create positive pressure. Connect the heparin saline. Do not withdraw anymore, but use the same push-pause method to flush in the solution. Repeat the same for the other lumen. Wrap the clamps and tips with gauze. The wrapping of gauze to the clamps and tapes are to promote comfort and prevent pressure onto the patient's skin once dressed and anchored down. Do the same for the other lumen. Proceed with the exit site dressing change. Remove the existing dressing gently. Be careful not to pull or tug onto the catheter at the exit site. Inspect the exit site for any redness, rash, discharges, or swelling. If present, please consult your nurse clinician or physician. Change to a new pair of non-sterile gloves after hand hygiene. Use the swab stick and start cleaning from the exit site outwards. Remember to apply firm pressure while moving in a zigzag motion downwards. Flip the tip of the swab over and do the same from center upwards. Use a fresh swab stick to clean the catheter lumen from in to out. Let the exit site dry naturally before applying a fresh dressing. The dressing of choice is a semi-permeable transparent dressing. This allows easy inspection of the exit site and the surrounding area. The selection of the type of dressing used would depend on the patient's skin condition and suitability. On the application of the sterile dressing, ensure that there are no air pockets or creases that may cause pressure or blisters on the skin. Loop the catheter into the figure J. Secure it by using anchoring tapes and further transparent dressings if required. This ensures that inspection of the site is not obstructed. Part the two lumen and curve it downwards in the figure M. Avoid the catheter from lying on the exit site. Again, this is to facilitate inspection and prevent pressure. More pieces of transparent dressing may be required to further anchor down the catheter lumens. The wrapping of the two catheter tips together is optional. Discuss with the patient and your family what is most convenient and suitable for them. Finally, remember to document all necessary information on the patient's notes. Refer to the following SOPs for the care and maintenance of a central venous catheter.